Hello everyone, welcome to the Biochemistry versus BRIYANI series. Yes, we are going to study biochemistry with BRIYANI because it's your favorite dish. Now look at the image here please. On top of the dish we have lemons. You're going to squeeze the lemons on top of the chicken pieces. Lemons are going to give you what? Vitamin C. Yes, we will study about vitamin C. And these chicken juicy pieces are going to give you what? Proteins. Yes, we will study about proteins. And towards the left side you also see the eggs. They are also going to provide what? Nutritious protein. Yeah. And then after eating the chicken pieces you are going to take an handful of rice and eat them. These will be providing you what? Carbohydrate. Yeah. And then now you find the biryani a little spicy. You're going to dip your fingers in the raita, which is going to give you what? Galactose. Yes. So with a simple Hyderabadi biryani, we are going to finish our biochemistry. Let's get started. Vitamins. Remember, vitamins are of two types. That is going to be fat-soluble and water-soluble vitamins. Fat-soluble comes with the mnemonic ADEK. ADEK. Remember with ADEK. Now, the water-soluble vitamins comes under B and C. Remember the mnemonic W, B, C. Yes. Now, fat-soluble vitamins, remember if they are deficient, that is going to be ADEK. If any one among these vitamins are deficient, the patient may have what? Malabsorption syndrome with steatorrhea. These are the following examples. They are going to be cystic fibrosis, celiac diseases, mineral oil intake, remember, can also make vitamin deficiencies. Yes. Now, something about the water-soluble vitamins, as we know, it comes with the mnemonic WBC. Remember, these water-soluble vitamins are easily washed out from the body except vitamin B12 and B9. Yes, B12 and B9. Remember, B12 is stored in the liver for 3 to 4 years. You heard it right, for 3 to 4 years. Whereas vitamin B9 is stored for 3 to 4 months. Please do remember. Moving ahead with the first fat-soluble vitamins, A. ADEK. Now we go with A. Vitamin A, remember, it is a very good antioxidant. It comes with retinol and retinoic acid. Remember, retinol is the constituent for visual pigments. Retinol is the constituent for visual pigments. Retinol, it is used to treat the wrinkles of the acne, and retinoic acid, it is the all-trans retinoic acid used for treatment of promyelocytic leukemia. Please remember, promyelocytic leukemia. Now, if vitamin A is deficient in the body, it is going to lead to night blindness, dry eyes, white hot spots and keratomalacia. Let's quickly revise once again. Night blindness, dry eyes, we have white hot spots and keratomalacia. Now, night blindness, it can lead to nyctalopia. Dry eyes is going to be xerophthalmia. White hot spots, remember, it is going to be having keratin debris with foamy appearance at the conjunctiva. Yes. And keratomalacia is going to lead the corneal degeneration. You can look at here. Keratomalacia leads to corneal degeneration. Now, acute toxicity of vitamin A can lead to nausea, it can lead to vomiting and also increased intracranial pressures. Whereas the chronic toxicity can lead to alopecia, dry skin and hepatic toxicity. Vitamin D. ADEK. Now moving to vitamin D. Vitamin D comes with D1, D2, D3. D2 is called as ergocalciferol. D3 is called as what? Cholecalciferol. Yes. Now, where do we get this ergocalciferol, sir? We get it from what? Ingestion of plants, fungi and the yeast. Here, it's a plant-based product. Vitamin D3 we usually get it from the sunlight and also via the ingestion or intake of what? Fish, milk and plant-based products. Yes. Now, what are the functions of vitamin D, sir? It is going to help you increase the absorption of calcium and phosphate. For increasing the absorption of calcium and phosphate, and also to increase the bone mineralization and also for increase of reabsorption at the iron levels. Yeah. Now, if the vitamin D is deficient in the body, in case of children, it can lead to what? Rickets. In adults, it can lead to osteomalacia. Remember, the vitamin D deficiency usually occurs due to malabsorption and decreased sun exposure or poor diet. These could be the reasons for what? For decrease in vitamin D in the body. Now, ADEK, moving on to E, it includes tocopherol and tocotrienol. The main functions are going to be what? It is an antioxidant. It protects the RBC and also the neuronal membranes from the free radicals. Therefore, if vitamin E is absent or very less in the body, it cannot protect the RBC or the neuronal membranes. Therefore, it can lead to what? Hemolytic anemia, demyelination of posterior column, ataxia or acanthocytosis. Remember with the mnemonic hard. H for hemolytic anemia, A is for ataxia, another A is for acanthocytosis, and D is for demyelination of posterior column. Yes, in case if the vitamin E is excess, it can lead to what? Enterocolitis in the infants. Yes. Now the last fat soluble vitamin ADEK. Moving on to K. K as K1, K2 and K3. K1 is called as phylloquinone, which is natural, and phytonadione is going to be a synthetic one. K2 is also called as menaquinone, and K3 is what? Menadione. Now, what are the functions of vitamin K, sir? Remember, K for coagulation. It is the main function of coagulation. In case if vitamin K is deficient in the body, remember in neonates it can lead to neonatal hemorrhagic, and then it can lead to increase in the prothrombin time and APPT. This vitamin K is very important for the maturation of the clotting factors. Which are they? Clotting factor 2, 7, 9 and 10. 2, 7, 9, 10. So this we conclude fat soluble vitamins. Now moving on to water soluble vitamins. What are they? Comes to the mnemonic WBC. Now moving on to vitamin B, B complex. We have B1, B2, B3, B5. We have B6, B7, B9 and B12. B1 is called as what? Thiamine. Yes. B2 is called as riboflavin. B3 is called as niacin. B5 is called as pantothenic acid. We have B6, which is pyridoxine. B7 is biotin. B9 is going to be folate, and B12 is going to be cobalamin. Please do take a screenshot of this PPT, because there is going to be probably one question from here. It's a very hot topic. Now, what are the diseases which can occur, sir, in case of deficiency? It can lead to Wernicke's encephalopathy. Vitamin B1 deficiency leads to Wernicke's encephalopathy or Korsakoff syndrome, or it will lead to beriberi. Very important. Remember, in case of vitamin B2 riboflavin deficiency, it can lead to chiliosis or corneal vascularization along with angular stomatomitis. Vitamin B3 niacin leads to what deficiency? Pellagra. We have 4D. First D is for what? Dementia. Yes, first D is for dementia. Second D is for what? Diarrhea. Next is for what? Dermatitis. And then we have what? Death. It can lead to also death. 4 Ds of pellagra is very important. B5, pantothenic acid, it can lead to what? Burning feet syndrome. It is due to what? Adrenal insufficiency and also distal paresthesia. B6, which is also called as pyridoxine, can lead to sideroblastic anemia due to the impaired hemoglobin synthesis and also hyperirritability. Vitamin B7, which is called as what? Biotin, it can lead to alopecia. B9, remember folate, it can lead to megaloblastic anemia, and B12 deficiency can lead to also megaloblastic anemia. Please do remember the names of B complex, and the deficiencies leading to its problems are all mentioned here. Please do revise well. Vitamin C. Now we have completed B complex. Moving on to vitamin C. Vitamin C and zinc. Remember, I think probably in COVID time everyone would have seen or heard this drug, which was called as what? Zinc COVID. The major contribution of this drug was what? Vitamin C. Almost it had 80 mg. Vitamin C was used in this tablet along with what? Zinc, which was one among the major minerals used. Now remember, why was this used, sir? Because it is what? It is a very good antioxidant and it helps for iron absorption. Vitamin C is also called as what? Ascorbic acid. Now if vitamin C is deficient in the body, it can lead to swollen gums, easy bruising and also decay. Now let's move on to zinc. Now let's move on to the protein parts. Let's take the chicken and try to enjoy it. Now remember, proteins are what? They are long chains of amino acids. There are going to be essential amino acids and non-essential amino acids. The essential amino acids comes with the mnemonic PVT, Tim Hall. I think everybody has studied this during the lecture. Now try to please revise them. Now what was the reason for me giving the chicken piece again? It's because chicken has all the required essential amino acids. Yes, it has phenylalanine, valine, tryptophan, threonine, isoleucine, methionine, histidine, leucine and lysine. So isn't it good to eat chickens? However, when I eat more chicken, now the amino acids have to be broken down, and the broken down amino acids gets converted into what? Ammonia. Now this is a problem to my body. Therefore, there comes a cycle called as what? The urea cycle. The ammonia, which is also the waste nitrogen, gets converted into citrulline via carbamyl phosphate. Now remember, there is an enzyme which is called as a rate limiting enzyme, that is going to be carbamyl phosphatase synthase. Please do remember this. What happens is citrulline gets converted into arginosuccinate, then it gets converted into arginine. Now this arginine is converted into urea with the help of water, and this urea gets into the bloodstream and via the kidneys they get excreted as urine. What do I have to remember in urea cycle, sir? Three things. Number one is going to be what? Carbamyl phosphate synthase, point number one to remember. Second, you need to also probably remember the enzyme between arginosuccinate and arginine. And third, during the conversion of arginine into urea, that is going to be urine. So please do remember urea cycle. Next. Now let's look into the pathway of the catecholamines. Phenylalanine gets converted into tyrosine via the enzyme phenylalanine hydroxylase. Tyrosine gets converted into dopa into dopamine. What do you have to remember for the exam, sir? You have to remember the L-aromatico amino acid decarboxylase, which is called as AAAD. Next, dopamine gets converted into norepinephrine and then into epinephrine. For the main exam, please do remember phenylalanine hydroxylase and also tyrosine hydroxylase. If tyrosine is acted upon by the enzyme tyrosinase, what would be the byproduct, sir? Please someone tell me the answer. Yes. The byproduct is going to be melanin. Very good. Maple syrup urine disease is also one among the hot topics which have been commonly asked. What is maple syrup urine disease? Let's look into it. It is when the blocked degradation of what? Branched chain amino acids. Muscles do have proteins now. When I eat protein rich diet, what happens? More amino acids get secreted. Therefore, these amino acids, what happens now? They get converted into what? Branched chain amino acids, BCCA. Now, this enzyme, BCKD enzyme, comes into action and produces energy and helps my muscles to grow as well. That is the reason why the gym going rats develop more muscles, because even they eat more eggs and more meat, because it helps a what? It gives growth and also energy. This is going to happen in what? Normal cases. Whereas in case I eat more chicken, I eat more proteins, and they have branched chain amino acids, but this enzyme is now absent in my body. If this is absent, what happens is the BCCA gets accumulated more and more in my body, and now this condition, it leads to the disease called as what? Maple syrup urine disease. Please do remember. Now, what are the presenting conditions, sir? The patient is going to present vomiting, poor feeding, and his urine is going to smell like what? Maple syrup. This is the maple syrup. This is how the maple syrup leaf, the maple leaf looks like. And the patient may also have what? Burnt sugar-like smell. Yeah. Next, Alkaptonuria, another important topic. Remember, in Alkaptonuria, the patient is going to have black colored urine, onchronosis, tendinitis. Let's revise again. Alkaptonuria, black colored urine, onchronosis and tendinitis. Once again, Alkaptonuria, black colored urine, tendinitis and onchronosis. It is due to the deficiency of homogentisate oxidate. This is the main point to be remembered. Due to deficiency of homogentisate oxidase. Now, what happens is the urine turns black on prolonged air exposure, and the patient can also have what? Kidney and prostate stones, along with kyphosis or the hunchback. Remember, Alkaptonuria, black colored urine, onchronosis, tendinitis, enzyme deficiency is going to be homogentisate oxidase. Yes, you're right. Now, homocystinuria and cystinuria. Let's see what is the difference. Homocystinuria is due to deficiency of cystathione synthase. Remember, it is due to deficiency of cystathione synthase. It comes with the mnemonic homocyst. Let's repeat, homocyst. H is for increased homocysteine. O is for osteoporosis. M is for marfanoid habitus. Another O is for the ocular changes. C is for the cardiovascular defects. And YS is for kyphosis. Yes. What is cystinuria, sir? It is the defect in reabsorption of the following amino acids. What are they? Cysteine, ornithine, lysine, arginine. Mnemonic cola. Please remember cola. Cysteine, ornithine, lysine and arginine. It is the hereditary defect of renal PCT and the intestinal amino acid transporter. Please do remember what is homocystinuria and cystinuria. In homocystinuria, remember the ocular changes. The lens gets subluxed. Lens subluxes down and inward. This is going to be seen in which condition? Homocystinuria. Whereas in Marfan syndrome, what happens? The lens moves up and outward. Moves up and outward. Yes. Now, you have squeezed the lemon into the chicken. You have ate the chicken. Now, getting on to the rice part. Rice gives us what? Carbohydrates. Yes, India is the land of carbohydrates because we eat more of rice and wheat. Let's go ahead now. Carbohydrates are further classified into monocarbohydrate, disaccharides, oligosaccharides and polysaccharides. The monosaccharides are, remember, glucose, fructose and galactose. Here we have the rice and the wheat. And disaccharides are going to be sucrose, lactose and maltose. Polysaccharides are the ones starch, glycogen and cellulose. Let's dive into more details now. Here, carbohydrates, remember, there are going to be 4 cycles that you're going to remember. That is going to be glycolysis, very important cycle. Number 2 is going to be glycogenesis. Number 3 is going to be glycogenolysis. 4th is going to be gluconeogenesis. What you have to remember is going to be the site and the rate limiting enzymes. Yes, the site, it is going to be at the systole. Systole, rate limiting enzyme is going to be phosphofructokinase 1. Glycolysis, rate limiting 1, phosphofructokinase 1. Glycogenesis enzyme is going to be what? Glycogen synthase. Glycogen synthase. Glycogenesis, rate limiting enzyme, glycogen synthase. Glycogenolysis, remember very easily, it has L, therefore the enzyme is also going to have L. It is going to be glycogen phosphorylase. Genolysis, it has L. The enzyme, rate limiting enzyme is going to also have what? L. Next, gluconeogenesis. Rate limiting enzyme is going to be neo, means new, formation of carbohydrates from non-carbohydrate source. It is going to be what? Fructose, 1,6 bisphosphatase. Very easy to remember. You have to remember glycolysis, rate limiting enzyme, PFK1. Next, we have glycogenesis, that is going to be glycogen synthase. Next, we have glycogenolysis, glycogen phosphorylase, and at last, gluconeogenesis, we have fructose 1,6 bisphosphatase. Yeah. Now, remember, glycolysis, it is the breakdown of glucose to produce energy. Glycogenesis, formation, it is the formation of glycogen, that is the excess glucose gets stored in the liver and muscles. Glycogenolysis, remember, lysis is to break down. Glycogen stored in the muscle gets broken down into glucose, especially during fasting. Gluconeogenesis, neo, the word itself says something new. Formation of glucose from non-carbohydrate source. Yeah. Now let's step more into details. We have type 1 disease, which is called as what? Wangerke disease. Type 2 is going to be Pompe's. Type 3 is going to be Cory's disease. Let's revise one by one. Type 1, Wangerke disease, enzyme deficiency is going to be glucose 6-phosphatase. Type 2, Pompe's disease, it is going to be acid maltase. Let's revise one by one again. Type 1 is called as Wangerke disease. It is due to glucose 6-phosphatase. Type 2 is called as what? Pompe's, due to what? Acid maltase. Now type 3 and 4 are going to be very easy. Remember CD, C for Cory's disease. Enzyme deficiency is going to be debranching enzyme. Anderson's, remember AB, Anderson disease is going to be due to debranching enzymes. Next we have McCall's, remember M for M, muscle glycogen phosphorylase, and H for Hirsch disease, hepatic glycogen phosphorylase. It's probably very easy to remember. Let's revise again. A for B, Anderson's, branching. Cory's, C for D, debranching. M is for M. We have McCall's, which is going to be muscle glycogen phosphorylase. Hirsch, H for H, Hirsch disease, hepatic glycogen phosphorylase. At last we have fructose intolerance, that is due to aldolase P. What other problems can lead to? Remember, type 1 can lead to hepatomegaly, or we have hypoglycemia. Pompe's can lead to hypotonia or cardiomyopathy, and type 3 can lead to hypotonia and again cardiomyopathy. Type 4, remember, it can lead to hepatosplenomegaly. At least please do remember the enzyme names. Now let's quickly revise the glucose transporters. We have GLUT1, GLUT2, 3, 4, 5 and more. Let's revise one by one. Remember, GLUT1, 2, 3 and 5, they are all insulin independent except what? GLUT4. GLUT4 is going to be insulin dependent. First point to remember. Next, GLUT1, where are the transporters located? Let's revise one by one. GLUT1, they are going to be at the bloods, RBC, blood-brain barrier and placenta. GLUT2 in liver and beta cells of pancreas, and also in the small intestine. GLUT3, remember, in brains and the neurons. GLUT4, most of the questions were asked GLUT4, remember, it is located in skeletal muscles, adipose tissues and cardiac muscles. GLUT5, remember, luminal side of the intestines, sperms, and it is a fructose transporter. Now, GLUT9, liver, kidney, and has urate transporters. Great. Let's revise shortly. Brain, which glucose transporter is it? Brain. Brain is going to be, please look at it, it's going to be GLUT3. What about liver? Liver is going to be GLUT2. What is this? Intestine. What is intestine, sir? GLUT2. Very good. RBC. RBC, GLUT1. What about this one, sir? Muscles, heart, that is going to be GLUT4. Great. Let's revise the lipid storage diseases, quite a high yielding topic as well. Starting from Niemann-Pick disease, enzyme deficiency is going to be sphingomyelinases. Look at the enzyme here. This is going to be Niemann-Pick disease, sphingomyelinases. Gaucher's disease, it is due to what? Beta-glucocerebrosidase. Remember Krabbe's and Fabry's together and Tay-Sachs and Sanoff together. Fabry is going to be beta-galactocerebrosidase, whereas Febris is going to be alpha galactose ribosidase. Tay-Sachs is going to be exosaminidase A. Remember at 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 Tay-Sachs at Sandhoff, this is going to be, remember, SAB, 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 Sandhoff exosaminidase A and B. Great. Now let's look into the other important diseases to be studied in biochemistry. One is going to be what? Zellweger syndrome. It is the inherited disease where the peroxisome is either absent or empty. What is the importance of peroxisome, sir? It helps in the metabolizations of very long chain fatty acids. Yes. Lipoproteinemias were also important topics where questions were asked very frequently. Type 1, what is it? Lipoprotein lipase deficiency. Type 2A, remember, it is going to be hypocholesterolemia, LDL receptor deficiency, and type 3, remember, beta lipoproteinemia. How were the questions formed? Let's look at the last previous year questions. Which among the following is increased in fatty meals after LPL deficiency? What is LPL? Lipoprotein lipase deficiency. What is going to be increased here? Increase in chylomicronizin. This was the answer for the past year's questions. Next, remember, in case of type 2A, there is going to be increase in LDL. In type 3, remember, there is going to be increase in IDL. Yeah. Alcoholic hepatitis, a non-invasive procedure which could be done is to look into the biomarkers. Remember, GGT, serum gamma glutamyl transferase, is used as the index of what? Liver dysfunction, and it is a marker of alcohol intake. Yes. So with this we have concluded biochemistry revision. I hope the session was useful. If any one of you require the PDF, kindly DM in kilstar.in Instagram, we'll send you. And until then, keep revising well. Every day you are getting closer to your dream, and wish you guys all the best. Cheers.